Hello, everyone. Can you stand up and sit back down from a chair 15 times in 30 seconds? It sounds simple, but this one test can tell you more about your risk of falling, your muscle strength, and even your long-term health than you might expect. Let's talk about it. This is called the 30-second sit-to-stand test, sometimes just called the chair stand test. Physical therapists and doctors use it all the time, especially with older adults because it's quick. It doesn't require any equipment besides a chair, and it gives a surprisingly clear picture of lower body strength and balance. Here's how it works. You sit in a standard chair, no armrests, straight back with your feet flat on the floor and your arms crossed over your chest. Then, for 30 seconds, you stand all the way up and sit back down as many times as you can without using your hands or arms to push off. That's it. But those 30 seconds reveal a lot. The test was developed back in 1999 as a way to measure leg strength in seniors, and it's held up remarkably well since then. It's now widely used to assess fall risk and to track strength changes in people dealing with things like osteoarthritis. For adults in their early 60s, women typically fall between 12 and 17 reps, and men between 14 and 19. As you move into your 70s, those numbers drop a bit, around 10 to 15 for women and 11 to 17 for men. By your 90s, the range narrows further, down to around 4 to 11 reps for women and 7 to 12 for men. For context, younger adults in their 20s and early 30s can often do around 33 reps in the same 30 seconds. So there's a natural decline over time, and that's expected. But if your score falls noticeably below the range for your age group, it could be a sign of reduced balance or a higher risk of falling. Why does this matter so much? Because your leg strength isn't just about fitness, it's about independence. Strong legs are what let you get out of bed without struggling, walk safely without fear of stumbling, and carry groceries up the stairs without needing help. When leg muscles weaken, everyday movement gets harder, mobility declines, and the risk of falling goes up. And falls are not a small issue. They're actually the leading cause of injury and injury-related death for adults over 65. That's part of why this simple chair test has become such a valuable screening tool. It can flag a problem before it turns into a serious injury. But the story goes beyond just fall prevention. Some recent research has found a connection between how well people perform on this test and their broader long-term health. Better performance has been linked to lower risk of conditions like type 2 diabetes, physical disability, depression, and even dementia. So this isn't just a test of your legs, it may be a window into your overall health trajectory. Now, if you try this test and your number comes in lower than you'd like, don't panic. There's good news. Research shows that consistent strength training can meaningfully improve your chair stand score in as little as 12 weeks. So what can you actually do about it? First, practice the movement itself. Simply doing sit-to-stand repetitions at home, even in short sessions, has been shown to build strength and make the motion easier over time, especially for people who are more frail. Second, focus on strengthening your quads, glutes, and hamstrings, the major muscles involved in standing up. Bodyweight squats, lunges, and resistance band exercises are great ways to target these muscle groups without needing a gym. Third, don't neglect your core. A strong core supports better balance, which directly affects how stable and controlled your sit-to-stand movement is. Simple exercises like bird dogs, standing chops, or knee planks can help build that foundation. Fourth, add in balance and stability training. Activities like yoga and Tai Chi are excellent for this. Tai Chi in particular has strong research support for reducing fall risk in older adults, thanks to its slow, controlled movements that train coordination and stability. And finally, consistency is everything. Muscle mass naturally starts declining after age 50, so regular activity matters. Aim for strength training 2 to 3 times a week to help preserve muscle and support long-term mobility. One last important note. If you notice your balance getting worse, if walking starts to feel harder, or if you're falling more often, don't just try to push through it. Talk to your doctor. They can help identify the underlying cause and guide you toward the right exercises, physical therapy, or other steps to reduce your fall risk. So here's your challenge. Grab a chair, set a timer for 30 seconds, and see how many times you can stand up and sit down. It's a small test, but it might just give you a big insight into your health.